Hi, everybody. In the previous lecture, I provided an overview of treatment services that are used in the management of alcohol and other substance use disorders. One of the things that has developed in the past 20 or 30 years is an attempt to broaden the base of that triangle, to bring more services to people with problems connected with lesser levels of substance use. And this has developed into a concept called screening, brief intervention, and referral to treatment, or SBIRT. It is a form of early intervention. And these programs have shown great promise, especially when you combine screening tests with short conversations between a clinical practitioner, whether it's a doctor or a nurse or a counselor, and a patient in a primary healthcare setting. The aim is to identify persons who are at risk of substance use disorders before dependence develops. And if a person is found through a screening test to have a substance use disorder, then the aim is to refer them to treatment. Brief interventions are a key part of this type of service. And the definition of a brief intervention is 5 minutes or less of behavioral counseling that targets a particular health behavior. It could be cigarette smoking, could be at-risk drinking, or it could be drug use. And the goal is to reduce or stop the consumption of that substance and facilitate treatment engagement for people who need it. And it relies on the use of screening data to motivate the behavior. This kind of intervention has been investigated through a series of clinical trials, which we'll be talking about in this course. And one of the first major international trials was the World Health Organization's Amethyst Project. This is one of the first projects that was conducted to investigate early identification. And it was called the Amethyst Project because of the supposed qualities of the gem amethyst, which is supposed to prevent drunkenness. And the Amethyst Project was conducted by the World Health Organization in 10 countries, where over 1,000 patients were randomized to 3 conditions: a control group that did not receive an intervention but were followed up after 6 months, a simple advice group who got 5 minutes of simple advice, and a brief counseling group that got more intensive counseling in a self-help manual. What was found when you compare males and females and you look at the 3 interventions is that the simple advice group and the brief counseling group both had decreased intensity of drinking at 6 months. They were drinking, on average, fewer percentages of the time above 5 or 6 drinks. They reduced the intensity of their drinking, and there wasn't a big difference between the people who got simple advice and the people who got brief counseling. Over the years, there's been a continuation of this research where hundreds of randomized trials have been conducted. And the results, when you put it all together, suggest that when people receive a brief intervention, the number of drinks per week over a period ranging from 6 months to a year is reduced anywhere from 13% to 34% compared to a non-intervention control group. And people can go from drinking at a hazardous level to a moderate level without having to abstain at all, if they're given proper counseling and if they're not dependent on alcohol. Other health-related outcomes have been studied. Quality of life improves after brief intervention, and one study in Malmö, Sweden, found that patients who were counseled and given feedback about elevated enzyme level for a liver enzyme that is sensitive to alcohol tended to have lower mortality after 21 years. So, with the promising results that have been developed around brief interventions for alcohol with non-dependent, heavy and risky users, research has begun to investigate the possibilities of doing screening and brief intervention with people with other types of substance use disorders. And the World Health Organization developed a screening test called the Alcohol, Smoking, and Substance Involvement Screening Test, which allows a clinician to identify people who are at risk of a substance use disorder ranging from tobacco to opioids and 8 substance classes in between. After developing the screening test, WHO went out in an international study conducted in Brazil and India and Australia and the USA. And what they found was that after receiving a brief intervention, patients identified in a primary care settings who were at risk of using substances in a problematic way, whether they were stimulants or opioids or amphetamines, that those people, after a brief intervention, significantly reduced their substance use. So to provide a summary of what we've been talking about this week, a number of treatment services have been developed to manage substance use disorders. We have treatment for people with alcohol and drug dependence. We have harm minimization programs, and we have screening and brief intervention programs. These programs all have been found at one level or another to be effective in reducing hazardous and harmful use of alcohol and other drugs. Research has contributed to the identification of the most effective treatments, and it's been very helpful in deciding what types of treatments and early intervention can be disseminated within the healthcare system. It's improved our understanding of the mechanisms of behavior change, how people decide when and how to change their substance use behavior. And service systems have evolved to the point where they can incorporate these treatments, but many of them do not. So what we're going to be talking about in the remainder of this course is how research can be used to improve the effectiveness of different services. Based on your experience, your readings, the lectures during the first week of this course, the next thing we want you to do is to look at your schedule and to find the activity that is recommended for this week. We want you to choose one of the treatment services described in your readings and the lectures, and provide a brief summary of its nature, its aims, the target groups it's directed at, what the scientific evidence is, and anything else you want to talk about in terms of that service. Use your readings, use your lectures, and report back to your program instructors. See you next week.